Assalamu alaikum my dear students. Once again welcome to my YouTube channel by the name MS Lectures, and today I will be describing you about the physiology and its important topic, that is the circulatory shock. So what is meant by the circulatory shock? Circulatory shock occurs when there is a decrease in the cardiac output which leads to the the dysfunctioning of the heart. So talking about the classification of the circulatory shock, we have three types of classification. We have the hypovolemic shock, we have the cardiogenic shock, and then we have the distributive shock. So we will discuss these three classification in detail. Let's see. So first of all, we have the hypovolemic shock. Number one, we have the hypovolemic shock. We have hypovolemic shock. So by the term you can see that hypo means less. So hypovolemic means low volume. So whenever there is a decrease in the cardiac output, so hypovolemic shock occurs. So there is the you can see two causes of hypovolemic shock. So two causes are one may be hemorrhage, and other may be loss of plasma. Loss of plasma. So if you talk about the hemorrhage may be occurred due to the, you can say any type of injury can lead to the loss of volume of blood, and also the loss of plasma in the case of vomiting and diarrhea. So it can also lead to the hypovolemic shock. So hemorrhage due to the injury and loss of plasma due to vomiting or diarrhea. Due to the vomiting or due to the diarrhea. So this is the hypovolemic shock. Now talking about the cardiogenic shock. What is the cardiogenic shock? Cardiogenic shock. So cardiogenic shock is whenever the heart weakens due to the weak activity of the heart, or whenever the heart is unable to pump. So you can say inability in the pumping of the heart leads to the cardiogenic shock. So weak heart. So due to the weak heart, cardiogenic shock occurs because it can lead to the decreased cardiac output because the heart is unable to pump the enough blood towards the whole body. So cardiogenic shock occurs. Now third type is a detailed one we will talk about now. The third type, that is the distributive shock. What is the distributive shock? So distributive shock is caused by is classified into the two types. We have sepsis and we have the anaphylaxis. Sepsis and anaphylaxis. So talking about the distributive shock. So in the distributive shock, you can say distributive shock can be caused by the can be caused by two reasons. First of all, we have the sepsis, and then we have the anaphylaxis. So if we talk about the sepsis, in the sepsis, what happens? The bacterial action. Due to the bacterial action, vasodilation occurs. So that's why it can lead to the cardiogenic circulatory shock. And the other is the anaphylaxis, in which what happens that the interaction of the antigen antibody occurs, which actually cause the release of histamine, leading to the vasodilation. So both are the, you can say, contributing factors in causing the circulatory shock. So we will talk about now the third classification of the circulatory shock, that is the distributive shock. That is distributive shock. Distributive shock. So just in distributive shock we have two main causes. We have sepsis. We have anaphylaxis, and also we have third one as well, neurogenic. So in sepsis, what happens? In sepsis, due to the bacterial action in the blood vessels, vasodilation occurs. So this vasodilation can lead to the circulatory shock, thereby decreasing the blood volume. And then we have the anaphylaxis. The this histamine causes the vasodilation and in turn causing the circulatory shock. Then we have furthermore about the neurogenic. So in the neurogenic, what happens? In the neurogenic shock, there is the depression of the vasomotor center. We know that the vasomotor center. So the vasomotor center actually, you can say, is responsible for the release of the sympathetic impulses. So if the vasomotor center is depressed, so what would happen? Depression of the vasomotor center would actually, you can say, decrease the total peripheral resistance. So decrease of the total peripheral resistance can lead to the circulatory shock. So what happens that the vasomotor center so the vasomotor center is depressed. In this case, vasomotor center is depressed. So the vasomotor center is depressed, and vasomotor center, we know that is responsible for the release of the sympathetic impulses. So its depression would lead to the, you can say, decrease of the total peripheral resistance, which is set to the TPR. It can lead to the decrease in the total peripheral resistance. So decrease in the total peripheral resistance can actually lead to the circulatory shock. So these were the three classifications of circulatory shock. One was the hypovolemic shock, cardiogenic shock, and distributive shock. And I have told you about the three classifications of the circulatory shock in detail, and hope you have understood it well. Last but not the least, don't forget subscribing MS Lectures. Thank you.